So I don't know where to stand for a start. Why don't you go over that side, Martin, and I go to this side. My name is Peter Fonagy. I'm one of the organizers of this conference, and I direct the mental health program at UCLPartners. I go to about 5 or 6 conferences a month. I'm kind of addicted to them. Actually, I make a living out of it, is the truth. But I go to lots of conferences. What I want to say is I've learned more at this conference between midday and now than all the conferences I've been to, certainly this calendar year. And the reason for that is really simple, because I haven't heard anything new. Everything that was said, I've heard before. Sometimes said more eloquently by somebody who actually has been practicing it for years and been using the same slides for many years, and I've seen them several times before. But this time I heard it said with feeling. And that aspect of human communication, that immediacy of it, is actually likely to make a difference. That's really what I think this is about. I think that a conference like this about the future of health is relevant only if we actually are going to be the future of health. If actually we are going to pledge and commit and undertake to do things differently. And to be honest, I've been teaching for 35 years. teaching at all levels, very many years. I do not have an enormous confidence that I've made a massive difference in anybody that I was able to teach. Because, you deliver a lecture and you do your bit and, people kind of listen to you and they're polite and they say, oh, that was very interesting. And you go away and you think, yeah, well, they'll forget it as soon as they walked out of the room. Usually they weren't listening to start with. The point is that if someone says something with feeling, the way the brain works, it actually is taken in and it actually makes a difference. So us listening and listening carefully to what you guys have been saying and what actually the whole tone of the meeting has been makes to me all the difference. But actually there's a snowball's chance in hell that it will change something. Now we all know that unless we change something, then we're all going to hell in a so-called, handbasket, maybe slightly bigger than that. Because, you must use every crisis that comes your way. And we certainly have got one coming. But there are 2 things that I really want to underscore, that I really want to take away from this meeting. The first is that I realized in listening just how attached I am to the systems that I work with. My research is in attachment, so I understand about attachment. And I think all of us have a loyalty to the systems that we work in that sometimes overrides the loyalty to the system, the loyalty to the people that we work for. And that's one of the things that I have to pledge to give up. That I have to put the people actually first, ahead of the service that I organize. That my budget line at the end of the day, and whether I look pretty to my managers, is not what really matters. But what really matters is what I am able to do for the people that I actually am supposed to be working for. In reality, not my bosses. Then the second thing I've learned about is self-management. I've been talking that self-management bit for a while. But actually, to be honest with you, I didn't really get it. I really just didn't get it. That self-management is not about self-control and locus of control and who, whether you are actually doing things by yourself or not. But it's about feeling in control of something that's going on around you that actually you have no control over. It's being faced with the uncertainty of a long-term condition that actually makes self-control so important. I never got that. Bit of a humiliating thing, but anyway, never mind. It's really, the self-control is essential, and we need to empower people to self-manage because they are facing something that actually is bigger than them and that they can't manage. And they have to be helped to cope with that challenge that none of us could cope with. So I want to thank you. And I want to thank all of us for listening. And I do hope that tomorrow will be an even better day. Thanks.
Thanks, Peter. So I'm going to try and be short. Well, I am actually. But the first thing I'd like to say is I think everyone's worked so hard. The drinks are on me after this. Okay? I also checked beforehand that they were free. So we're going to have a drinks reception afterwards. Ruby Wax will be here. Please come and join us for a drink. Let's continue the conversation. Let's continue the dialogue. And the second thing is, let's pledge. Let's use the pledge wall. I've got a couple of things that I'm reflecting on. My mind is buzzing. I knew I'd taken on a big job, but now I realise how big. And I think long-term conditions are going to require long-term change. So it's not going to happen overnight. It's not going to happen quickly. We're going to have resilience and courage. And I think the co-design thing is absolutely critical. I think that we need access to information. We need to increase social awareness of the importance of long-term condition, and that a lot of people who are carers have long-term conditions as well. And it's not about curing me, it's about my quality of life. But there's one thing that really, really is now uppermost in my mind. A while ago I read a book by a guy called Schultz, and he described that leadership for change or creating change is a big job. But one of the things which stuck in my mind, he talks about 3 groups. There's the choir, and I think we're the choir. And it's great singing with the choir. But there's an audience, and what we need to do is to get them to sing as well. And they're bigger than us. They're massive. They're out there doing the job day in, day out. Their heads down, they're not quite sure what's going on, they're not going to conferences, they're not participating. We need to help them, and we need to work out how to reach out to the audience and get them to learn the song as well and work with us on this. And that's a big job to do. And then there are the statues. And I think what we need to learn to do is to ignore the statues and go around them, okay, because they're fixed. And I think the last thing I'd just like to say is just quickly is to talk about the funding, because I went to a lecture by Greg Dyke, ex-Director General of the BBC, and he said, follow the money. He said the accountants will try and make it difficult, but if you understand the money, then you'll understand how to make things happen. And tariff is only a very small component. In fact, tariff works into the acute sector. The whole of primary care, most community care is actually just block funded. It's a very odd system we've got. And it's actually perfectly designed to almost foil us to deliver what we've been discussing today. So we're going to have to do something about the funding, and we're doing a lot of work on that at the moment, on the year of care, and looking at how can we transform the way that we fund the system so it really truly does support people, brings resources into the community. But that means that we're going to have a national health service, not a national hospital service. And one of our challenges is, will the choir help sing the song that we need to be less focused on hospitals and more focused on how do we create a health service, a health and well-being service. So lots to think about. My pledge is to really go out of here and have an implementation mindset, actually think, okay, what are the things we need to do to make the change happen, and arm wrestle with that over the next, actually I don't know what my life expectancy in this job is, but as long as I've got, I will continue to arm wrestle with that monster and try and make it happen, because I've been touched by what I've heard today. It's why I came into the profession, and just thank you ever so much for revitalising and re-energising me, and I just hope tomorrow is just as good and gives me even more problems to think about. So thank you very much. I'm definitely going for a drink. I hope you'll all come and join me. Thanks very much indeed.